Today's topic is freaking amazing. It is about Sculptra. Sculptra is my favorite biostimulator. I'm going to tell you guys what a biostimulator is, why you need it. We're going to talk about the treatment protocol that I use in my practice. We will talk about what kind of results that you can expect, how much it costs, and we're going to go over things that just aren't true about Sculptra that you may be hearing. Welcome to the Perfect Dose Podcast. I'm your host, Dr. Kristen Herzog, board certified nurse practitioner and injection specialist. You guys, I am literally getting ready to fly to Europe. I'm starting today's episode a little bit different than my typical episodes. I wanted to give you guys a life update and share exactly what I'm doing, what's been going on, and then we're going to get into the topic. And today's topic is freaking amazing. It is about Sculptra. Sculptra is my favorite biostimulator. I'm going to tell you guys what a biostimulator is, why you need it. We're going to talk about the treatment protocol that I use in my practice. We will talk about what kind of results that you can expect, how much it costs, and we're going to go over things that just aren't true about Sculptra that you may be hearing. I'm going to address the biggest misconceptions. So, like I said, I'm getting ready right now to go to Europe. This is the first time that I've been gone for 2 weeks, ever. So I can't believe I'm actually taking a vacation this long. We are also traveling with baby Jax. So for all of my moms listening, I will be posting on my Instagram stories exactly how this goes. We have only let him nap one time today. So maybe I'm a mean mom, but in my mind, I'm a smart mom because I am hoping that he sleeps the entire flight. We're doing an overnight flight. So we literally go straight from Phoenix to London, 10 hours nonstop. Then we have a 4-hour layover and then we go London to Milan. So wish us luck. It's going to be really exciting. We're going to be gone for 2 weeks. We're going to Rome, Florence, Sicily, Barcelona. We're going to Saint Tropez, and we're going to see the Amalfi Coast. So stay tuned for more updates on that. And now let's get into today's episode. So what is a biostimulator? A biostimulator is something that is going to force your body to stimulate its own natural collagen. And why does that matter? Why is that important? You guys know I'm all about the why when it comes to injecting anything in your face, putting anything on your skin, putting anything in your body. It's important to understand the why. So why do we need biostimulators? Well, every single year, our body loses collagen, and collagen is the protein in our body that makes our skin firm, bouncy, tight, elastic. As we age, we lose collagen, and this starts literally at 25, you guys. It starts when we're young, and that collagen never comes back. It just declines. So biostimulators are a way to force your body to stimulate more collagen when we're not producing collagen. And this is going to be hugely impactful for how your skin looks, how it feels, for fine lines, for wrinkles, for our skin's firmness, bounciness, for everything that makes our skin look youthful on the outside. That's because of collagen. So if we're losing it every year, we need to do something to put it back. So that's the purpose of a biostimulator. And biostimulators, you guys, are regenerative medicine. It's something that's actually creating change at the cellular level, which is huge. We are in an era of regenerative medicine. So I think it's so important to understand treatment options that you have. Sculptra is one of the biostimulators. There are other biostimulators on the market that can be injected in your face. There are biostimulators that can be topically applied. There are also biostimulating devices like Morpheus, Cool Peel, things that create collagen in your skin. But today we are talking about Sculptra. Sculptra is PLLA, which is poly-L-lactic acid. And what happens with Sculptra is it is injected into your skin and it comes in a powder. So this is a funny concept for patients because we have to rehydrate the Sculptra. We have to add water to the Sculptra in order for it to work. So the best analogy that I have for Sculptra is that it's going to work like a garden. If you imagine Sculptra being the fertilizer for your garden, and the PLLA is going to then be spread around all over your skin. And what's going to happen is that water that we added to the Sculptra is going to get reabsorbed. And then you're going to be left with these little seedlings that are going to stem and grow and sprout collagen over time. So you're going to have this beautiful garden with lots of collagen plants all over your face. So everywhere we inject Sculptra, you are getting collagen stimulation. And what's really great is that PLLA actually leaves your body in 3 days. So PLLA is biodegradable, meaning it gets broken down by your body and you're just left with your own collagen. So there is nothing in your face but your own, which is pretty freaking incredible. And that collagen, just like we don't lose it overnight, it's not going to grow overnight. So the thing with Sculptra to keep in mind is that results results take time. You are not going to see change immediately in your skin. You're going to see change over the course of 4 to 6 weeks. And Sculptra requires multiple treatments for that reason, because I don't know how your body's going to stimulate collagen. So I'm going to need to assess you every 4 to 6 weeks during your treatment plan to see how your body's stimulating collagen. And typically we will do 2 treatments. So I will get into the protocol in just a minute, but I wanted you guys to understand exactly what it is, which is this garden of collagen. So everybody needs it because we are losing collagen every single year and we're never getting it back. So Sculptra is injected in your skin. Topical numbing can be applied. I don't usually numb in my practice because I make my pinch harder than my poke. And that's something I tell all my patients. Before I poke them, I literally pinch their skin and they don't even feel the injections. There's also lidocaine in the Sculptra. So injections are very comfortable. There's minimal bruising, minimal downtime because we are injecting Sculptra like a fan in your skin. So I'm making one entry point and I'm moving my needle all around. Anytime I inject you, there's the chance of bruising. So I tell my patients, even if I've seen you for 5 years and I've never bruised you, today could be the day. So never go into an injection planning on not bruising. Plan to bruise, be happy if you don't. That's what I love to say. But know that there's going to be not a lot of pokes with Sculptra and it's minimal downtime. When you leave the office, you are going to look amazing because you have all this water in your face. And then over the next 3 to 5 days, the water's going to be gone and you're going to be like, I look worse or I didn't see anything. And that's because we have to wait for that collagen stimulation. So Sculptra is not for somebody that wants instant results. Sculptra is for somebody that wants natural outcomes, that understands that this is a journey. It is not instant results and instant gratification, but the results are so well worth it. So what does a treatment protocol with Sculptra look like? Like I said, you come to the office, you're going to be injected with Sculptra, which is hydrated with water. You're going to leave looking amazing and then the water is going to go away. Typically, Sculptra is injected with 2 vials. I use 2 vials every single treatment. Some patients require 3, but on average, it's 2 vials. And then after Sculptra, you have to massage. So you go home, you massage for 5 minutes, 5 times a day, which is pretty annoying, but it's something that helps the collagen spread around. If you think about massaging your skin and working in that Sculptra, you're just spreading those little seedlings of collagen all around to make the product work better. So you get these 2 vials injected, then you come back 4 to 6 weeks later and you get another 2 vials injected. And after that treatment is when patients really start to see results. So what I do is after my patient's second treatment of Sculptra, I will say, we're going to see what you look like in 3 months and we're going to decide, do we need to do another Sculptra round? Are we happy with your outcome? Do we need to maybe do some filler to enhance? Or are you just on maintenance? So treatment protocols are 1 treatment of Sculptra for anybody that's looking for prevention. So if you're 20, you need 1 Sculptra treatment, which is 2 vials. You come in, you get injected, and you're done. We assess in 3 months, we see how you look, and then you're going to do your maintenance treatments every single year. So 1 time every year for Sculptra. If you are somebody that is looking for prevention and correction, that's when you're going to need multiple treatments. So if we're not only preventing collagen loss, but we're correcting maybe some volume loss, skin texture issues, you're going to need multiple treatments of Sculptra. And that's where that protocol comes in, that you will come in for 2 vials. You'll go home, you'll massage, you'll do your thing. I'll see you back in 6 weeks. We will do another 2 vials, and then we'll assess your outcomes at 3 months. So what exactly can you expect with Sculptra outcomes? When I'm saying that I'll see you in 3 months, what am I looking for? Well, if we know that collagen loss results in decreased skin firmness and skin sagging, what can we expect with Sculptra? We can expect better skin texture, better skin quality. We can expect firmer skin, bouncier skin. And in areas where you've had volume loss, like if you're looking in the mirror right now and you see that you've lost volume in your cheeks, maybe you've lost volume in your smile lines, these are areas that you can expect to see results with Sculptra. So what can be treated? My favorite areas to be treated with Sculptra are going to be the temples, and temple hollowing is something that I talked about on a previous podcast. It is one of the #1 signs of aging. So if you're listening right now and you're looking in the mirror, if you see hollowing in your temples, you could consider Sculptra there. And I inject Sculptra a full vial in your temples. The next area that we can treat with Sculptra is going to be your cheeks, your cheek wrinkles, anywhere on the side of your face. If you literally get your hand and you put it on the side of your face, that entire area can be treated with Sculptra. We can treat the jawline with Sculptra. We can treat your smile lines with Sculptra, your nasolabial folds. We can even treat your chin wrinkles with Sculptra. So anywhere you've lost collagen, where you're seeing increased skin laxity, meaning loose, sagging skin, you can treat this with Sculptra. And you can expect to see that skin change over time, which is pretty amazing. Now, how much does Sculptra cost? You guys are all listening right now. You're like, okay, I want some Sculptra. When can I get it? Is there anybody that can't get it? So Sculptra is pretty much for everyone. If you have an autoimmune issue that's in an active flare, I'm not going to recommend getting Sculptra. If you have an allergy to beets, this is an interesting one, but Sculptra, PLLA, is derived from beets. So if you have a beet allergy, you cannot get Sculptra, and if you're pregnant or breastfeeding. So anybody that has any of those conditions is not a candidate. Now, if you have an autoimmune issue, but it's well under control, you haven't had any active flares in a while, you are a candidate for Sculptra. So I'm always going to defer to getting a consultation with an experienced provider to go over a detailed medical history to determine if this is right for you. But most people are candidates. Now, cost of Sculptra is going to vary. A Sculptra treatment is $1,900, and that Sculptra treatment is 2 vials. So again, if we're preventing, then you can plan on $1,900 every year for your Sculptra maintenance. If we are preventing and correcting, we're going to need to invest in 2 treatments of Sculptra. So you're going to be spending $1,900 one treatment. 4 to 6 weeks later, another $1,900. But after that, what's really great is we can maintain your Sculptra results with 1 treatment per year. So $1,900 per year. So the same maintenance plan for all of my patients. It just may vary in how many treatments we need to get you to full correction. So I can't talk about Sculptra without talking about the myths surrounding Sculptra injections. Everybody listening, if you're familiar with Sculptra, you have heard that you may get nodules after Sculptra, or you can't get a facelift after Sculptra. And I'm here to tell you that is absolutely not true. I'm going to explain to you guys why. So why can you get a facelift after Sculptra? Why is it safe? Well, Sculptra stimulates type 1 collagen, and type 1 collagen is the most abundant collagen found in our skin. It is important to understand this because there's a little bit of type 3 collagen that is formed as a byproduct of type 1. And type 3 is scar tissue. So when people are like, oh my gosh, Sculptra gives me scar tissue. Well, yes, it gives a little bit of scar tissue, but everything gives a little bit of scar tissue because type 1, the collagen that we want, cannot be formed without a little bit of type 3. It just can't happen. So I'm going to show you guys this graph for everyone watching on YouTube. You can see that type 1 collagen is the most abundant collagen that is produced with Sculptra. Now, another really important thing to note is that in the studies, we found elastin formation, and elastin is one of the components of our skin that makes our skin firm, bouncy, tight, elastic. It's an important component of collagen stimulation, and elastin cannot be formed in an inflammatory state. So what that means is if Sculptra was really forming all of this type 3 collagen, all of this scar tissue, there would be no way that we actually have elastin shown in the study. And there is elastin in the study, you guys. So this is just proving that Sculptra forms type 1 collagen, a little bit of type 3 collagen, but not enough to make facelifts not possible. And trust me, I know many plastic surgeons that love Sculptra that perform deep plane facelifts effectively. I know many patients of my own that have been treated with Sculptra that we've taken a detox, and I'll tell you guys about my detox, that have gotten amazing results with facelifts, and they're fine. And I can also tell you that I plan on getting a facelift, and I definitely get Sculptra every single year. So what is a detox? A detox is when, before you get a facelift, you just do nothing to your face for a year. No Sculptra, no fillers, no Botox, no lasers, nothing. You give yourself a complete break. That way your plastic surgeon can assess your face at baseline. So that's what we do. We detox your face before a facelift. The next thing I want to talk about is nodule formation. And what happened with Sculptra is Sculptra was actually FDA approved years ago for lipoatrophy. Lipoatrophy is hollowing, loss of fat in the skin, and this is found in HIV patients. So they started using Sculptra for lipoatrophy, and they were finding amazing outcomes. Like, wow, patients with HIV are looking amazing. They're getting the volume back in their face, but they were getting nodules. Well, with an HIV patient, it didn't really matter that they were getting nodules because we were getting the fat treatment, the lipoatrophy. That's what Sculptra was treating. But then we started using Sculptra for aesthetic use, for cosmetics, and we just had to learn the product's personality. Like anything with the launch, when we first get a product in our hands, we don't know how it works. We don't know how it's best utilized. And originally, Sculptra was literally being put in our bras to heat it up. We were mixing it weeks in advance. We're like, okay, maybe if we add the water sooner, maybe if we heat it up, we won't get nodules, it won't clog. Now that we've had the products long enough, we went back to clinical trials and found that we just needed to add more water to the Sculptra. So Sculptra is now diluted with 8 cc's of water, whereas before it was diluted with 5 cc's of water. And we found that with proper injection technique and with the proper dilution rate, there were no nodules in the study. So most important takeaway from today, you guys, is to find a provider that is experienced with Sculptra, that is highly trained, that knows how to safely inject you, that can determine if you are a candidate, and you are going to have amazing outcomes with Sculptra. And it is absolutely safe to get Sculptra and get a facelift. We just need to do a detox. Another hot tip for you guys before I close today's episode is that you can actually biohack your filler with Sculptra. I have a whole episode on this, so if you haven't listened to it, listen to it now. I will see you guys next week. Thanks for tuning in to today's episode. You can find me on Instagram at The Perfect Dose.